So, medication to treat attention deficit or hyperactivity disorder. So, children with ADHD may require medication to reduce hyperactive behavior and also lengthen the attention span. So, attention deficit hyperactivity disorder or ADHD, it is a psychiatric condition characterized by inattentiveness or hyperactivity and impulsivity. The baby who have ADHD, the sign symptom we can see easily distracted or inattentiveness, hyperactive, impulsive, impair the social and academic functioning. So basically, we have to take a patient history data from informations or from parents, teacher, also rule out the other disorder. So what are the treatment? Basically, we use central nervous system stimulant. It is called CNS stimulant, like amphetamine, methylphenidate, or CBD. Let me read it. Medications that are most effective in controlling this disorder are CNS stimulant, means central nervous system stimulant, right? And CNS stimulant are effective in controlling this disorder. And this medication, which increase agitation and activity in adult, have a calming effect on children with ADHD and increase alertness and severity of stimuli. Next, medication to treat attention deficit or hyperactive disorder. The medication name: amphetamine, then methylphenidate, dextroamphetamine, or dextroamphetamine and amphetamine, or methylphenidate, or methamphetamine. So out of all, most common or popular medication, amphetamine and also met or methylphenidate. So most common indications ADHD and mechanism of action of all medication, they block the reuptake of neurotransmitter and dopamine and increase the attention span and decrease impulsiveness and hyperactivities. What else? Side and adverse effect: tachycardia, anorexia, weight loss, and elevated blood pressure, dizziness, and agitation. Intervention: monitor for CNS side effect and adverse effect, obtain a baseline ECG. Also, monitor the blood pressure. So, what are the other side effects or most common side effect? I said insomnia, dysarrhythmia, decreased appetite, and weight loss. So do not admit at the night time because it can cause insomnia, and give medication 30 to 40 minutes before meal. Monitor body weight and also height during the therapy. So intervention: the child and parents are instructed that OCT medication must be avoided. right? So the child and parents are instructed that last dose of the day should be taken at least 6 hours before bedtime. Okay. Monitor body height and weight, particularly in the children. So as a healthcare provider, monitor patient body weight as central nervous system stimulant decrease the appetite, maintain structured environment, constant rules, decrease distraction, provide medication in the morning to prevent insomnia. And classroom like teacher academic subject in the morning provide frequent breaks. It reinforce that the 7 weeks of therapy may be necessary before therapeutic effect is noted. Reinforced instruction to the child and parents that the drugs-free period may be prescribed to allow growth of the child if medication has causes the growth retardation.